Okay, David, whenever you're ready.
5 years ago, my cousin stepped on a rusty nail, and obviously he had to go to the hospital. So when we got there, the first question he was asked was, "Mr. Lemus, how are you planning to pay?" Then he was asked, like, "Do you have insurance?" And the last question was, "Okay, Mr. Lemus, what brings you here?" So my cousin thought like the sequence of the questions were kind of absurd. My cousin at that time was a full-time grad student, and he was working a part-time job on retail sales. The things that the paycheck of his part-time jobs didn't cover the cost of his health insurance. For that reason, he couldn't afford a health insurance. Thanks to the Affordable Care Act, right before the law was enacted, my cousin was able to enroll in a quality health care plan, and ever since he needs to go to the doctor, he no longer needs to worry about he can afford the expenses of the treatment. So as my cousin, up to 11 million of Americans got covered by affordable insurance plans under the Affordable Care Act. So today I'm here to persuade all of you about why the Affordable Care Act shouldn't be repealed by the Congress, and I want to briefly explain what this law is about and how effectively it's working for most Americans. So let's start talking about what the Affordable Care Act is about. The Affordable Care Act, also known as Obamacare, is a health care reform law that was signed in 2010 by the President Barack Obama. Basically, Obamacare is a set of new benefits, rights, and protections that were created to reduce the healthcare spending and to improve the healthcare services and the health insurance in the United States. For example, under the Obamacare, it was created a mandate for all Americans to have an insurance. It also was created a health insurance marketplace in which the government helps to subsidize small businesses and low-income families to get insurance, affordable insurance. This law also eliminates pre-existing conditions and protects against gender discrimination, and finally it expands free preventive services and healthcare benefits. So the things that, however, in spite of how detailed, how organized, and how well structured the plans of the Affordable Care Act are written, a bunch of critics question whether the Affordable Care Act works as effectively as expected in real life. So I want you to see this argument on both sides of the picture. On one side, there's a bunch of critics that says that the Affordable Care Act is not going to work. That is not convenient for most Americans, and the affordable insurance don't exist. On the other side, I want to show you proofs, I want to show you evidence that demonstrate, there is numbers that demonstrate that the Affordable Care Act exists, the Affordable Care Act as a law is working, and there are a lot of evidence that shows that it's doing well, that the Affordable Care Act is working. So first, opponents of the Affordable Care Act claim that the healthcare reform would lead to a serious decline in full-time employment, because employers will reduce the workforce hours to below 30 per week in an effort to avoid the responsibility to provide health benefits to their employers. Surprisingly, it turned out that the opposite side is taking place. In the Affordable Care Act, it's stated that the government would subsidize small businesses to encourage them to keep providing insurance for their employers. As proof of this, the Wall Street analysts and the healthcare experts say that the law has helped the industry financially by providing customers to insurers and paying patients to hospitals. Also, according to the, I don't know how to pronounce this word, but it's kind of the Office of Labor Statistics, they say that the number of part-time jobs has fallen by 300,000 and since March of 2010, which was the month that the Affordable Care Act became a law. Finally, and the final point I want to make is that in the past year alone, full-time employment grew by 2 million, while part-time jobs keep decreasing by 70,000 last year. So I wanted to show you this graph that shows the change in employment during the recovery time. And if you can see, the period of time between 2010 and 2014 was like 2010 was like the year that Affordable Care Act became a law. And you can see that right before 2010, in this part of the graph, you can see that employment time, full-time employment was going down. And right after 2010, it started to going up. So we can see that ever since, full-time employment is being increasing constantly. So it shows that, I'm not saying that the recovery time was because it gets better because of the Affordable Care Act. But if you see, the opposition says that because of the Affordable Care Act, will impact negatively the full-time employment and the economy. On the other side, if you see part-time jobs, it's been basically the same through the time since 2010 to 2014. Now, there has been another point the Affordable Care Act challengers said. The Affordable Care Act new rating rules would increase premium cost, would increase the cost of coverage, and would destabilize insurance markets. Actually, this isn't true, because the main goal of the Affordable Care Act is to create affordable insurance for the people. So insurance have decided that the marketplace is good for business and consumers have more choices. Evidence of this is, we can see this in Troy Greer's article, "Is the Affordable Care Act Working?" in a post he made in the New York Times. So 85% of those who signed for insurance during the enrollment period qualified for government assistance. Also, 7.7 million of people in 37 states using the healthcare platform qualify for an average of 263 per person in advance premium to credits. So we see that if each person in a family receives almost $300, and you see that you have to pay around $1,000 per family, well, like 11,000 per family. Each month you're going to receive the same amount of money, and even if you are richer, you're going to receive less. But if you are poorer, you're going to receive this amount of money, which is good, which is like a proof that this Affordable Care Act is working for Americans. So I want to show you this picture, and I know that the Affordable Care Act is not going to work for everyone. There's going to be people that won't get covered by this law. But I want to show you that this image represents how people that don't get covered by the Affordable Care Act and still have the chance to get covered by a quality of insurance. So as you can see here, there's a lot of people. It's like go shopping. You can choose from a variety of different insurance plans, and you can choose the plan that fits to your necessities, that fits to your budget. So this is basically how the Affordable Care Act is working for those who won't get covered by this law. And finally,
You have to really close it up. I gave you extra time, but it's over 10.
okay, so I want to conclude by saying that as you can see, there is reliable evidence that shows that Obamacare is working effectively in terms of affordability, quality, and accessibility. Families and business and taxpayers are better off because of it. So as you can see, there's no consistent evidence that shows the Affordable Care isn't working, and instead there is consistent evidence that shows that with progress and with some adjustments, the Affordable Care Act will work now and in the future. Thank you.